This conference will now be recorded.
Welcome everyone. Good evening. Thank you for joining us for today's webinar. My name is Afifa and I'll be hosting this session on behalf of Biosetup Lifesciences. Now let's welcome our founder coordinator Agadeep Das sir and our keynote speaker Dr. Manupriya Verma and all dear participants. Now, before we proceed, let me enlighten you about Biosetup Life Sciences. Biosetup Life Sciences is a hub for scientific research and learning approved by ISO 9001:2015 certified organization, having a multidisciplinary team of faculty and research associates that provides support to aspiring students in life sciences. We have successfully organized many workshops, courses, career counseling, and competitive exam preparation like CSIR, IIT GEM, CUET PG, GAT B, IISc, and DBT. We are continuously working for the career upgradation of the students. Today, we at Biosetup bring this webinar on topic colon hydrotherapy, a potential procedure to prevent colon cancer by Dr. Manupriya Verma. Dr. Manupriya Verma is ex-senior research officer of Department of Neurology in AIIMS. Ma'am did research on stem cell study in patients with Parkinsonism, now running multicentric non-invasive heart care centers in Punjab. Ma'am is treating heart patients, advice for angioplasties and bypass with non-surgical and painless treatment with EECT. Dr. Manupriya Verma is setting a benchmark in field of cardiology with enhanced techniques. This is all about the introduction of our keynote speaker. Just a little housekeeping before we get started. Please do not share your audio, video, or screen to avoid any kind of disturbance. If you have any questions during the presentation, please type them into the chat box. Also, regarding your joining time and leaving time, everything is being recorded and accordingly your attendance will be marked automatically. So, kindly be present throughout the session. Without further ado, we will turn the time over to Dr. Manupriya Verma. Over to you, ma'am. Thank you.
Hello, everyone. Thank you for the pleasant introduction, and I thanks Biosetup Life Sciences and Aragedeep for bringing this very nice platform for sharing our experiences and knowledge with all of you. So today I will be sharing the topic of colon and colon cancer, including colon hydrotherapies. So first of all, I would like to share about what is called colon. Colon is a part of digestive tract and is a tube-like organ into the abdomen that is associated and linked with the small intestine. So the colon is a part of large intestine and is divided into four segments. That is ascending colon, descending colon, transverse colon, and sigmoid colon. So otherwise, large intestine is divided into four parts. That is cecum, colon, rectum, and anal. So we'll be dealing with the colon, what and its cancer. So colorectal cancer is also called as bowel cancer, colon cancer, or rectal cancer. So cancer is a development of benign tumors or polyp inside the walls of the intestine, which slowly and progressively develop into the malignancies and become cancerous. So, what are the signs and symptoms of the colon cancer? It may include blood into the stool, change into the bowel movements, sudden weight loss, and extreme fatigue. So, what are the reasons behind this colon cancer? Is our sedentary lifestyles and poor mode of junk food that we eat, and genetic disorders and other chronic disorders that lead to the formation of this chronic diseases. What are the classic warning signs that we come across this cancer? Is worsening of the constipation. Person who suffers from the constipation and doesn't take care of it and just ignores that develops and further worsening into the sign and symptoms leading to the chronic cases. Sometimes it develop blood into the stools and decrease in the stool caliber, thickness of the stool varies, People feel loss of appetite. There is sudden weight loss. Some people may or may not feel the signs and symptoms and can live a normal life also. In some patients who are above 50 years, around 50% of population with the colorectal cancer do not report any symptoms. So they live a healthy and may live disease-free life also. However, rectal bleeding or anemia are high-risk symptoms in the patients above 50 years of the age. What are the classical warning signs and causes of this colorectal cancers? Are sometimes maybe poor diet, habits like excessive intake of red meat, processed meats, and that leads to inflammation of the intestinal walls. Excessive consumption of alcohol as it causes more of acidity and fluctuation of the pH levels of the body, obesity, smoking, lack of physical activity. So these are the risk factors, common risk factors that can lead to the colorectal cancers and other forms of cancers as well. Other risk factors that we have to keep in mind may be inflammatory bowel diseases, which includes Crohn disease and ulcerative colitis. What is the Crohn disease? It is the inflammation of the lining of the intestines, and in ulcerative colitis, it is a severe form of inflammation of the digestive tract, including the large intestinal wall linings as well as the rectal lining. Other risk factors may include genetic disorders like familial adenomatous polyposis and hereditary non-polyposis colon cancer. However, these represent less than 5% of the cases. So next part we will discuss will be how to diagnose this type of cancer. As normal, obviously a biopsy is always taken to detect the cancerous part, may it be benign or malignant. So colorectal cancer also may be diagnosed by obtaining a sample of colon during sigmoidoscopy or colonoscopy. This is then followed by medical imaging to determine whether the disease is benign or has further spread to a metastatic form. During colonoscopy, small polyps may be removed, so it is a surgical treatment as well. We can, treat it during the diagnostic way also. If there is a large polyp or tumor is found, biopsy may be performed to check if it's cancerous or malignant. So the conventional treatments for this colorectal cancer may include some combination of surgeries during the diagnosis when sigmoidoscopy or colonoscopy is being conducted. Other ways are like conventional treatments include for the cancer is radiation therapy, chemotherapy, and targeted therapies. In this way, sometimes of this benign cancers or polyps can be treated, but other malignancies may not be treated. Cancers that are confined within the wall of the colon may be curable with the surgery, while the cancers that are spread widely is usually not curable. So, what is the survival rate of this colon cancer? It may depends upon what has been extent of this cancer. So, if it has been can be removed with a surgery or with overall health, can be determined whether survival rate. So prevalence of this colorectal cancer is we all know that it's a third most common type of cancer and making up to 10% of all the cases. The US has been most affected country with this type of cancer as 1.0 million new cases are found every 6 months with this disease and has raised to the highest mortality cases all over the world. It's more common in developed countries as we are aware that the people have under went to with the more poor lifestyle and poor dietary habits that has developed to this type of cancer. So, into which gender it is most common is men are more affected than a women. So, colon cancers and other gut diseases are directly or indirectly related with the brain health, even as we know that gut brain axis is a wisely used term that when a gut is compromised, your brain health is also compromised. So, dealing with all these problems, we can always prevent the complications of a disease, and proceeding with it, we can try with this what is colon hydrotherapies. Hydrotherapies are the ways to clean the colon, or it's also called as colonics in the ancient form of cleansing of the colon, large intestine, and rectum with the temperature and pressure controlled filtered water. It is drug-free, safe, and effective method of removing impacted fecal matter, retained gases, mucus, and other waste materials from the colon safely and effectively without disturbing the flora of the intestines and maintaining the pH of the body. The procedure has definitely evolved with time, with modern technology ensuring the safety and sanitation of this popular clinical practice. So we should always embrace the new technologies, and it is a complement it is a functional medicine designed to clean and detoxify patients' gastrointestinal system. Why there is need to cleanse the colon? As we know that the most of the diet we consume lacks fiber, lacks the good probiotics, and the intestines is left with the poor flora and the poor microbacterium that leads to the sluggish metabolism, leading to poor digestion and incidence of constipation, development of toxic gases, bloating, and irregular bowel movements, which further deposits toxins into the body that form throughout with the blood circulation affecting other parts of the body, especially the brain. The toxins that affect the brain and mental health. These microbes produce toxic waste in the form of acids and gases, which turns cause inflammation. Once the inflammation has started, it travels throughout the body and travels other parts of the body as well. The toxic substances damage the intestinal tissues as well as the nerves and glands and around the gastrointestinal tract. Toxins can then be absorbed through the walls into the blood and lymph, ultimately to the other body cells, tissues, and organs. So the other problems are also associated with the gut health. It also promote abnormal brain function as well as cognitive mood and behavioral problems. So when you suffer from mental issues, make sure that your gut health is maintained properly. Thus, although the human body does a pretty good job detoxifying itself on regular basis, but sometimes we failed to eliminate the waste through the normal procedures. So here comes the role of the colon hydrotherapy when the normal process don't do its job properly. So, what is the principle behind the colon hydrotherapy? During the procedure, the water that is used to irrigate the colon basically hydrates the wall. It don't suppresses the intestinal functions. It just hydrates the colon, just making into more flexible and promoting its own peristaltic movements to move the fecal matter towards the anal and then expelling out the toxins out from the body. As a result, the old impacted fecal matter, mucus, and other substances are loosened and washed out. So, the other benefit of this colon hydrotherapy is observed that it improves the functions of the muscles in the colon, leading to more effective peristalsis. This function is also called as colon muscle retraining procedures in the old people who suffer from loose muscles and leading to incontinence can help this situations to get better with this therapies. Thus, it is especially beneficial to those who suffer from the sluggish intestine, thereby causing improvement in the intestinal muscle function to absorb the nutrients in the more better manner. As a result, a lot of people experience an increase in energy levels and feeling of well-being when the toxins are removed well from the body. You feel instant relaxation and fresh. It is to hypothesize that immunity level also improve with when your gut health is improved. Gastrointestinal tract plays an important role into the production of immune cells, thus giving you good health and energy to do other roles. So the three steps of colon hydrotherapy is first is hydration of the colon. It is water safely hydrates the or irrigates the colon. Then activation the peristaltic movements of the colon so that it can do its function well. Peristalsis evacuates the contents of the colon, thus making it hydrated and the good microbes to develop so that the health of the intestine is maintained. So now comes how this colon hydrotherapy procedure is being done. So patient is been lying down on the bed of the colon hydrotherapy machine. It is very well designed machine, very much comfortable machine on which a patient lies comfortably. A nozzle has been inserted into the anal region and lukewarm water is influshed into the colons directly with a temperature of 40 degrees Celsius, and there is a continuous scoopus enemas is been done through which there is a pa- parallelly there is expulsion of toxins is been done. Patient counseling is done to hold water as much as possible unless patient feels fullness in the abdomen with the water, where they can hold the water as much as they can hold, but then can release immediately when they are unable to hold the water and the toxins are released simultaneously. A screen has been placed in front of the patient in where he can visualize how the toxins are being expelled out from his body. Then the patient is instructed to slightly release the poop out. The drainage system of the apparatus is designed in such a way that it itself eliminates the feces into the sewage system of the colon. So it is very much sanitized and healthy to perform the procedure without disturbing any. So around 40 liters of lukewarm water is used to clean the colon repeatedly. So there is not a there is a myth that 40 liters is been retained into the body, but not. It's been expelled out simultaneously along with the waste. The cleansing process take about 40 minutes to complete one session of the colon hydrotherapy. Ideally, 4 to 6 sessions are required to completely cleanse the colon in the intensity of 1 to 2 sessions of colon hydrotherapy per week. So, in one session, 600 grams of toxins can be expelled out from the body, and it covers about one by four portion of the intestines. So, ideally, 4 to 6 sessions are recommended for the complete cleansing of the colon. Who are the people who needs to go for this colon hydrotherapy? People who are suffering from malfunctioning of the gastrointestinal system or poor metabolism, including continuous constipation. Even they try to use many of the conventional system to clean their bowels, like taking lot of laxatives, and they get habitual with that laxatives. People suffering from bloating and gas, indigestion, irritable bowel syndrome that is much prevalent these days, with the pain abdomen, irritation, allergies. Other symptoms also represent into the irritable bowel syndrome. Bad breath, constant coating over the tongue. It indicates the acid reflux systems, which develops that white coating over the tongue. Feeling fatigue, lethargy. Prior to the colonoscopy, as a part of weight loss program, also the colon hydrotherapy can be performed. The most important benefits of this hydrotherapy is a patient immediately feels relaxed, lighter, and feel energetic, feeling of well-being, and renewed vitality. And what are the side effects and risks? That doesn't include any potent side effects and risks, but mild abdominal cramping may be prevalent, bloating or fullness, and that are very temporary. It can be relieved within a day or so. Soreness in the anal area may be there. So, thank you for the session. I hope this has been very informative to all of you and may promote this knowledge with everyone. Hello? Hello, Raghadeep.
Thank
Am I
you,
audible?
ma'am.
Yes, ma'am, you are audible, ma'am. Now, students,
Okay.
if you
Yes, ma'am.
have any doubts, you can ask in the chat box.
I hope I have clarified the topic well and I'll be answering the queries in the chat box. So I don't think I have any relevant query related to the topic. So if anyone have can drop a message personally also. I will be sharing my number with you, everyone. So am I over, Haragiri?
Yes, ma'am, please wait sometimes, ma'am, so that people have any doubt, they will write in the
Yeah,
chat
yeah.
box.
Sure.
Ma'am.
I'm there. If anyone have any query can share.
Old address, new address, ready and oh, address is sir. Prakash, old number, JC.
Hmm. So I have a question from Mr. Abdul. So they have written, can we treat this cancer with any gene modifications? So yes, we can treat with the gene modifications once the extent of the disease has been known, whether it has spread to other organs and to how much extent, then we can always treat it with other conventional methods also as well as with gene modifications. So other question, second question is from Mr. John. Can an injury to stomach causes cancer in intestine and can it be seen with the help of CT abdomen or not? So any injury to the stomach causes cancer intestine. It is not usually, but it can be developed with the chronic manifestations of the diseases, not to any such injuries. And the cancer can be detected from the colonoscopy or sigmoidoscopy like investigations and the biopsy uh, sample taken from the colon. Another question is, how long can I live if I have a colon cancer? So the prevalence and mortality depends upon the severity of the condition. You can always lead a healthy life even you have a colon cancer. Many people don't even have the symptoms and live a normal healthy life. And if you modify your lifestyle, including a good intake of the food, you can always improve the conditions. Like you have to modify leaving the food products that can cause inflammation of the intestines, including wheat, dairy products, red meat, etc. So when if you modify your lifestyle, you can always live a healthy life. So any other questions? Okay, another question has come. Is this therapy affordable for common people? Like, yes, of course, it is very affordable and approachable to everyone, and everyone can take this therapies, and it's just cost 2,500 to 3,000 per session. And it's always recommended once a week, not too much frequent sessions, as it may sometimes called can cause the upset of the flora of the intestines, normal flora. So to maintain that flora, we have to maintain the time span. Okay, so another question is how colon hydrotherapy is done. Colon hydrotherapy is done by the very advanced machine. On this machine, a patient lies down comfortably and a rectal nozzle is being inserted, in which there is inflow of lukewarm water into the intestines, where it dissolves the toxins into the liquid form and expels that toxins from the body simultaneously when the water inflows inside the body. And this procedure is carried out for the 40 minutes continuously till the patient is comfortable enough that the toxins had been removed from the body. Another question is, can we deliver drugs for this, like in the form of liposomes? Yes, as shared earlier, the it depends upon the severity of the disease whether it can be treated with the drugs or with the surgery. Can the cancer in the colon be transmitted in vertical transmission, that is, from mother to child during the parturition? Yes, the genetic manifestations do occur in such forms of cancers, along with other comorbidities like lifestyle, weight gain, and other reasons. Other chronic diseases can lead to this colon cancers. The most common symptoms are maybe pain in the abdomen, frequent weight loss, and lethargic feeling. Lots of weight loss can be occurred. Bleeding from the rectum can occur. These are the common symptoms. So basically, we are. What is the question? Basically we're expelling the waste. So how this could be linked with the treatment of cancer? So we are not treating the cancer with this therapy, we are just providing giving the good healthy lifestyle to the person who are more prone to this type of diseases. In this way they can keep their intestines refreshed, hydrated, and healthy, so that the disease can be prevented. We are not curing this disease with these therapies. That it is a, yes, you are right, it is basically a preventive procedure, not a curative. Are there any alternative treatments to colonic hydrotherapy? So conventional enemas are also available parallelly to this colon hydrotherapy. The concept is same, just to clean the colons, make them hydrated, make the peristaltic movement of the intestines easy, and maintain the flora of the intestine. So the basic reason behind is just to make the colons healthy. So other types of conventional enemas, water enemas or coffee enemas are also prevalent these days to give that same results. Any other questions? How many stages in there in colon cancer? So as like other cancers, it also divided into two forms, benign and malignant only, and similar like other cancers, other form of cancers. These sessions are carried out once in a life, then it is a permanent cure of disease. So this is the answer. Like we just want to make the diseases, preventive cure, not a treatable. So if we follow the healthy lifestyle and adopt good living, maintain yourself, maintain the good healthy lifestyle, then we can always have this permanent solution. Otherwise, simply doing this hydrotherapies cannot not treat the diseases. We are just making this to prevent the diseases. So thank you everyone for joining this session and taking active participation. I hope this session has been informative to everyone.
Thank you so much, ma'am. We appreciate the information that you have shared with us today. It was indeed an informative session. Now, I would like to hand over the mic to our founder, Alvidip Das sir, for a vote of thanks. Over to you, sir.
Okay, am I audible?
Yes, sir. Yes,
Yes,
sir. You are
Aragami.
audible.
Okay. Very good evening to one and all. At first, my heartfelt thanks to our eminent guest speaker, Dr. Manupriya Burma. And I thank you for accepting my invitation for a interactive talk. It's sort like a webinar. And ma'am, the topic of your collection is so useful for all because the colon cancer is increasing day by day, and it's causing a huge problem to the global healthcare system. And maximum peoples are died also for this cause. And you know it's a bit like a diagnostic oriented point of view you are talking now. And
Yeah.
the way you share your knowledge regarding this session was so impressive and attractive for all, because this topic was so vast, ma'am, and in 1 hour talk it's not possible to tell and insight knowledge, giving all insight knowledge about regarding this topic. It's so much big, and it was so remarkable and miraculous experience from all, because and you spare your precious time and share your valuable knowledge with us. It's give me a immense pleasure to deliver a vote of thanks to our today's eminent guest, Dr. Manupriya Burma, ma'am. And once again, I thank you for such an interesting, knowledgeable talk. And I'm sure that people are liking it too. And it was so our privilege that you were presented an interesting talk, and that enlightened our students and researchers. And I hope you will able to make your presence in future events too. And we are so pleasure to have you in between us. You also join in our scientific advisory members, so that is our so glad and so privileged for us. And I'm looking forward to organize more event in future too, ma'am, with you. Thank you once again, ma'am. And
Thank you so much,
now my
Aragami.
heartfelt, yeah, and my heartfelt thanks to our organizers and event coordinator, Dr. And all advisory members. and Afifa, Miss, our organizers, and so wonderful and anchoring, and she is doing and welcoming the guest and fruitfully handling whole session. It's truly recommendable. And thank you so much all for joining today's event and investing your precious time for this talk and support us. Last but the not least, on the behalf of Biosetup, I thank each and everyone for the contribution. This webinar a successful one, and I'm definitely looking forward to arranging many such events. And maybe in future also we will plan for many events. So thank you all, and have a good day ahead. Good night. If you have any doubts, you can contact with ma'am, and she is so good profiled. She is also now running its own startup, that is a soil health in Punjab. So if you have any relatives or anyone, those who have problems regarding healthcare systems, so you can definitely ping out ma'am. You can definitely contact within LinkedIn also. She is so well profiled, and she is so much good knowledgeable, and literally I'm so much connect with ma'am. I feel that whatever the things I'm sharing you guys all, so please do that. And if you have any doubt, can contact with ma'am for any now she is also looking for colon cancer. That's why actually our work is to make sure to make people's aware about that. So this is not a research oriented, this is like a diagnostic oriented talk, so that at least people can know what is the problem actually going on, right? So,
It's ideally a preventive session, preventive care
yeah,
for the colon cancers.
exactly, exactly. So, thank you everyone once again. So, investing your time and listening us, and please fill your feedback form. It is already in the chat box. Then you can leave the meeting, and so that after filling, we will get the certificate of this event. You can download the certificate from the Google Drive link. Okay, thank you all.
Okay, thank you
Thank
everyone.
you so much, sir. Thank you, ma'am. Thank you, everyone. We appreciate you being here. For the participants, filling out the feedback form is mandatory for your attendance. The feedback link has been shared in the chat box. Certificates will be generated automatically only after submission of feedback form, and the feedback link will not be shared on WhatsApp. So make sure to submit the form before you leave the meeting. Thank you so much for joining us in this webinar. I hope we will see each other again in future. Goodbye and best of luck for your future. Thank you.